Is it possible to reverse osteoporosis? The truth and what you can do now. Osteoporosis affects many people, especially as we age. You've probably heard about this condition, but the question is there a cure for it? Is it possible to reverse osteoporosis for those who already have it? Let's explore these questions and understand what can be done to improve bone health. So stay here until the end and take the opportunity to leave your comment if you already know someone with osteoporosis or if you yourself have it. So, let's go. Start at the beginning. What is osteoporosis? Osteoporosis is a disease that weakens bones, making them more susceptible to fractures. Imagine that our bones are like a dense sponge. When we have osteoporosis, this sponge begins to lose density, creating small holes that weaken the bone structure. Over time, these porous bones can break more easily, even with small falls or sudden movements. This condition mainly affects women after menopause, but it can also affect men and younger people, depending on risk factors such as family history, prolonged use of certain medications or diseases such as rheumatoid arthritis. Simple case to illustrate. I'll tell you a quick story to help you understand. Mrs. Marta, 65, has always been active and healthy. But one day, when she tripped on the living room rug, she suffered a hip fracture. She was surprised, after all. She hadn't fallen hard. It was actually a minor injury. After tests, she was diagnosed with osteoporosis. This story is common in emergency care throughout Brazil, and early diagnosis is essential to avoid serious fractures and start treatment right away. Can we reverse osteoporosis? And after a person is diagnosed with osteoporosis, is it possible to reverse it? Stop having osteoporosis? Unfortunately, we can't talk about a complete reversal. Once bone mass is lost, we can't recover 100% of it. However, the good news is that there are treatments that can stabilize the condition, prevent further bone loss, and even improve bone density. This means that, with the right treatment, it is possible to reduce the chances or prevent fractures and thus improve quality of life. Available treatments. There are two main approaches to treating osteoporosis: medications that prevent bone loss and medications that help form new bone tissue. 1. Anti-resorptive medications. These medications, such as bisphosphonates, alendronate and risdronate, and denosumab, work by reducing the rate of bone loss. Think of them as a brake that stops bones from becoming even more fragile. They are indicated to prevent fractures and maintain the bone mass that we still have. Bisphosphonates are medications that are usually the first choice for treating osteoporosis. They are effective in reducing the risk of fractures and help to stabilize the condition. Denosumab is the other option. It is administered by injection and also works to prevent bone loss. It is particularly useful in patients who cannot take bisphosphonates, which come in tablet form, or who have more advanced osteoporosis. 2. Osteoanabolic medicines. Here, we are talking about medications that stimulate the formation of new bone tissue. These medications are indicated for more severe cases or for those who have already suffered fractures due to osteoporosis. There are two medications. 1. Teriparatide. This medication mimics the parathyroid hormone and helps to form new bone. It is indicated for those with severe osteoporosis and is administered by daily injection. Teriparatide can increase bone density by up to 12% in 2 years, which is significant. 2. Romosozumab. This is a newer medication that has shown promising results in patients at high risk of fractures. It is administered monthly and acts both on bone formation and on reducing bone resorption. Sequential treatment. To get the best results, doctors often recommend a sequential treatment. This means that the patient starts with an anabolic drug, such as teriparatide, to stimulate bone formation, and then moves on to an anti-resorptive drug, such as bisphosphonates, to maintain the gains. This strategy has been shown to be very effective in preventing fractures in the long term. But as I always say, each case is different, and you will discuss the best approach with your doctor. Deal? Enviar feedback. Limite de caracteres. 50,000. Use as setas para traduzir mais. Resultados de tradução disponíveis. The role of supplementation and lifestyle. In addition to medications, calcium and vitamin D supplementation play a role in the treatment and prevention of osteoporosis. Calcium is one of the main components of bones, and vitamin D helps the body absorb this mineral. For those with osteoporosis, it is important to ensure adequate intake of both, but do not overdo it, as this can cause other problems. As for calcium, the daily recommendation for adults over 50 is around 1,200 milligallons per day, which can be obtained through diet and, when necessary, through supplements. And vitamin D, which helps the body absorb calcium, depends largely on sun exposure, but many people also need supplements to reach adequate levels. To know whether or not you need to take supplements, your doctor will request an exam, as excess vitamin D can also cause problems. What about physical exercise? Exercising is essential, and even better, when supervised by a physical education professional. Impact exercises, such as walking, running, and climbing stairs, help to strengthen bones. Resistance exercises, such as weight training, are great for strengthening muscles and improving balance, which helps to prevent falls, one of the main causes of fractures. Risk factors and prevention. Now, what about those who do not have osteoporosis? Is it possible to prevent it? Preventing osteoporosis starts with healthy lifestyle habits. If you have risk factors, such as a family history of osteoporosis, early menopause, prolonged use of corticosteroids, or autoimmune diseases, it is important to be aware. If you are in the age group at risk, especially postmenopausal women or men over 70, talk to your doctor about having a bone densitometry test. Prognostic scenarios. And what to expect during treatment? I organized this section into 2 scenarios. 1. Favorable scenario. If the patient strictly follows the treatment, including the use of medications, has no side effects, takes the correct supplements if indicated, and exercises, it is possible to stabilize or even improve bone density. In this scenario, the risk of fractures will be drastically reduced, and the person can live without major limitations. 2. Unfavorable scenario. If the treatment is not followed correctly, or if important medications are interrupted, the patient runs the risk of suffering serious fractures, such as hip or spine fractures. These fractures can lead to loss of mobility and chronic pain. Conclusion. Osteoporosis is a serious disease, but with proper treatment, it is possible to control it and improve quality of life. Although complete reversal of osteoporosis is not possible, there are ways to strengthen bones and prevent fractures. These are the ones I mentioned. If you or someone you know is going through this condition, seek medical advice. And if you liked this video, don't forget to like it, subscribe to the channel, and share it with anyone who might benefit from this information. Here, Daniel Coriolano. Big hug, and see you in the next video that's appearing on the screen, and I know you'll like it.